Good afternoon, everybody. Welcome to the webinar. We are going to get started in about 2 minutes. So I just wanted to let you all know that you're in the right place and we will be starting shortly. All right, we're going to go ahead and get started. Good afternoon. This is Danielle Farisi, Program Manager at LPHI, working with the Primary Care Capacity Project. Welcome to this afternoon's webinar on recruitment and retention. This webinar is presented under the Gulf Region Health Outreach Program, Regional Care Collaborative, also known as the RCC. The RCC is a learning community of primary care clinics that provides opportunities for technical assistance delivery and fosters peer-to-peer exchange among organizations across the Gulf Coast region. In today's session, Ann Hogan will share strategies to address recruitment and retention of medical staff, which is a challenge that many of our partners have told us that they face. So hopefully this will be a very on-topic and helpful webinar for everyone. We had many people register for this webinar today from various projects across the coast. If you have a question, please go ahead and type it into the question box. We are going to keep all of our attendees on mute for the duration of this webinar. We will answer your questions at the end of the session. Additionally, if you need to step away, please do not put us on hold because we will hear your hold music. So just put us on mute. Lastly, this webinar is being recorded and will be posted to the PCCP wiki page for future viewing after the session today. Now, I would like to turn it over to Ann to begin our session.
Thank you. And now do I have control of the slides, I hope?
You should now.
All right, let's see. Sometimes it takes just a few seconds.
There we go. All right.
All right, there we go. So I, first of all, want to thank the Louisiana Public Health Institute and Danielle especially for all your help in putting this together. I am presenting this on behalf of the STAR² Center, which we will talk about in just a few minutes, and all the resources that they have available for anyone looking at recruitment and retention. So my background is I've actually worked in a health center. I worked there for 18.5 years. I left it almost a year ago. I was the VP of HR with the responsibility of recruiting all levels of staff, including professional staff, physicians, dentists, psychologists, nurse practitioners. I mean, you name it, we had it. We were a very large health center with 650 employees, 14 sites. And I am from Colorado, but believe me, there's some really tough areas to recruit for in Colorado due to various reasons. Not all communities have access to the mountains very quickly, which is what people come to Colorado for. So I understand the importance of trying to recruit for both your rural places and your urban or pretty remote places. And it's a different challenge, and we'll talk about kind of how those differ as we go through this. First of all, I will talk about the STAR² Center. And I would encourage anyone after this webinar to go visit their website, phcworkforce.org. On that website, there is so many resources that you can go through and see for yourself what all is available. Now, I'll run through those really quick. First of all, it's a partnership with the Bureau of Primary Health Care. Your PCAs and PCOs is how the STAR² Center has been funded. And it's absolutely a win-win for everybody because for anyone using their services, it's primarily free. And I mean, I'll say that again, it's free. They have recruitment and retention articles, links, resources. All of that information is free to you to use. Now, you may have heard about the STAR² Center, and if you are a CEO currently on the phone, or if you're someone who works with your CEO, make sure that they check their emails or talk to Allison at the PHI coming up next week to find out how they get their data profile. If any of you are in HR or finance, you do have to do the UDS. And what they've done is they've taken the UDS information and put it into another format where you can see how you rate compared to other health centers. And not in a good or bad way, they just flag different numbers depending on what you may need to look at. You may be different. And that information could be different in the sense that you have a lot of dentists, or you had a lot of turnover, or you were you had not as many physicians as you normally have, and all that information is very, very good, and it's hard to explain without seeing a data profile. But make sure the data profiles have been sent to all the CEOs back in March, and if they don't have that, please contact Allison at the STAR² Center, and she'll make sure she gets that to them. There's also a self-assessment tool on their website. I've used it. I think it's fabulous. It takes a minute to fill out, but it'll ask you questions like how many of your providers are over the age of, say, 60. And that would just kind of, it makes you think, because it makes you think, oh, wow, I have 30% that are now up in that retirement stage. I may have to look at recruiting and filling those vacancies in the next couple of years. How am I going to do that? And it asks a whole lot of questions. It doesn't take very long to complete. And the great thing about it is that you fill out all the information and they instantly send your report back to you. And it is really nice. They also offer newsletters every month. They also do webinars available to anyone who wants to participate. And again, those are free. They have the Best Practices Forum. They also offer, this is a copy of the data profile that you can see, and there's blue marks that kind of are outliers. And I'll skip through that slide here real quick. But so they do have monthly webinar series. They do have video tutorials. They do conferences and training, and they support things like this. They also offer totally free technical assistance with recruitment and retention. There's a number of people that they've contracted with throughout the United States that have different expertise in different areas, and you're put in touch with one of them, and they will help you kind of devise a plan or talk about what else they can see you need to add to your recruitment and retention policies. It's absolutely fabulous. So make sure you contact them. And before I go, make sure that you also, on my presentation, go to their website, because at the bottom, if I go back a few, if you go to their website, at the very bottom of one of the pages, it has these 3 circles. And it'll ask you for a drop-down box if you want to learn about cultural competency and what you can do in your health center. Recruitment and retention toolkit, a variety of different things. So it's very important that you go to that website and check out all the tools that they offer. Now let's get started on what we're all here today for, which is learning about recruitment and retention. So the importance, I hope that all of you have a recruitment plan in place. Everyone should have one. It's part of your 19 requirements to some extent. It's part of that needs assessment and all of that information for F2HCs, and they are required to have a recruitment plan. Now, some people consider their EEOC and their hiring plan as their recruitment plan. That's really not what a recruitment plan is. A recruitment plan has a number of elements to go through, and the one thing it does is it keeps you focused. And when I say that, I don't know if any of you watched the Olympics last week with Michael Phelps winning the gold for his multiple golds, but one of the captions that I saw on a photograph, and it really kind of leads into our discussion today about focus, is he was swimming for the gold. He's looking to the, to the end of the pool. The gentleman next to him, who I believe took second, was watching Michael Phelps. And it really has to do with recruitment. You can't watch what everybody else is doing. You need to have your focus on what you need to get done and not worry about what other people are doing in the pool. And it really makes the difference between coming in first or coming in second. And that photograph really sums that up. And it also outlines all of your actions and can provide protection from risk. Because when you're talking about hiring staff, you're always at risk. There's a lot of employment laws, and we'll go through some of those today, and you need to make sure that you are following every single one of those laws. And people need to know about what those laws are. So your 6 elements of a recruitment plan. One thing that you consider is your no discrimination policy, which would be your EEOC policies, etc. And we'll go through those in detail. What is your philosophy and responsibility? Who's doing what? Too often, health centers or other organizations kind of put all of that onto the HR department. I came from HR. There's a huge responsibility in the hiring process for HR, but there's also a wider, broader responsibility that goes up to the entire organization when it comes to recruitment and retention of employees. That can't be just in one area of your organization. It's a cultural shift that you need to make sure everybody is doing, and everybody has the responsibility for recruitment and retention. Where are you going to advertise? Advertising has changed in just the last couple of years. So we'll talk about some ideas of where you can advertise your position. What is fair and equitable selection, and how can you make sure that that's happening within your site? What does your application process look like? And now in the day and age of mobile phones, computers, you can't have kind of the old school paper application. You might want to be able to have one that you can hand out if you absolutely have to, but that's really not where the application process is any longer. And if you don't have an updated application process and a talent management system in that sense, that's something that maybe you want to look at in the near future, because it really makes the difference between someone thinking this is a quality organization versus, wow, they're really behind the times. And then talk about your selection process. So we'll start off with the no discrimination. Employment laws. I don't expect anyone in your organization to be necessarily an absolute expert in employment laws unless you're an employment attorney. But everyone needs to have a basic understanding. And of course, HR should have probably a very great understanding of all of these, and along with your CEOs and other people that are making decisions. Your medical director needs to be aware of what the employment laws are within the state. And anyone who interviews, I cannot stress that enough, anyone who interviews any applicant for any position needs to be aware of what the laws are. They don't need to know them in detail, but they need to know what they can ask, what they can't ask, how they should ask a question, and have an interview guide available to them. For instance, if you have someone I've had managers at one point say, well, but do they have kids? And they want to ask that question. And that's really not the question that you want to ask. You want to ask, okay, we're open from 8 to 5. Are you able to work those hours? Occasionally we need you to work until 7 or 8 for night clinic. Are you able to work those hours? That's what you should care about. You don't care if they have kids at home and they pick them up from daycare. That's not the concern. The concern is, are they able to work the hours that you need them to be there? So your employment laws, you have the Title VII of the Civil Rights Act of 1964. This has been updated a number of times, but it is illegal to discriminate based on any race, color, religion, national origin, and sex. Also, you cannot discriminate against anyone who's pregnant or can become pregnant. I've also seen that where people are concerned with hiring, say, a woman who's in her early 30s because they feel like, oh, she doesn't have kids yet and she might have kids soon. That is illegal. You cannot have any kind of pregnancy discrimination. Your age discrimination, it includes anyone who's over the age of 40 is in a protected class for age. Disability Act of 19, you need to make reasonable accommodations for people with disabilities. It doesn't mean that you need to spend thousands and thousands and thousands of dollars redesigning something, but you need to make reasonable accommodations within your center for people with disabilities. The Genetic Information Act was passed in 2008. You can look up that act. It's rather it's kind of sad that we had to actually put that in the act, but basically any genetic information that people have, you cannot discriminate based on that genetic information. So whether you have someone whose father or mother was extremely intelligent, you cannot test that person's genetic information to figure out if they also would be that way. Nor can you say genetically they may be predisposed to diabetes and therefore they'll cost us more in their health insurance. You cannot use that information or do any kind of testing in the hiring process. Fair Pay Act, everyone should have the same Fair Pay Act. Does it mean that everybody has to be paid the same? No. But it means that you cannot discriminate based on race, color, religion, sex, national origin, for any of those pay reasons. So you need to make sure that you're paying fairly and consistently throughout your organization and not using any of those factors as a deciding factor. The Family Medical Leave Act allows employees to be off for up to 12 weeks for a medical incident for them, for their family member. And I'm sure everyone who's in the health center has been familiar with the FMLA Act, so I won't go into that in detail. And then make sure you know your state and local laws, because they may take precedence over the federal laws when it comes to hiring or just basic employment practices. So make sure you know what those are. And make sure, again, that anyone interviewing is aware of those laws. So your responsibility. The responsibility is you want to provide quality applicants for your managers to actually interview. So you need to have a consistent and systematic process in which you're making those decisions. Usually HR is responsible for that. Usually if you have 100 applications for maybe one position, you have to call it down to something. And so how are you going to make those decisions? You need to make those decisions based on the quality metrics as to what are you looking for in that position. And so it should be part of your recruitment strategy that you're offering only quality people for those hiring managers to look at. Utilizing a variety of recruitment tools to be successful. This is not an all fits one position. So different positions require different strategies and different tools in order to be successful. Include always your mission and values, and only hire the best candidate, not the best applicant necessarily. So when you look at your position, what does it really require? I've had someone who wanted to put a bachelor's degree requirement in all their front desk staff. And that just was not, they really could not articulate why a bachelor's degree was important for the front desk. And so really look at what are your requirements, and do they really fit the position? If you say you have a lot of decision-making, say you have a front desk position and you want them to have a lot of decision-making, do you really provide a lot of decision-making for them? Or do they just follow certain rules and they really don't have a lot of decision-making capabilities during their daily tasks? A medical assistant or a physician, how much decision are they making on their daily tasks? Or is that important or is that not important? And you kind of look at how your jobs are designed. What skills do they really need? And this really falls into the idea that you need to think about what skills you can train for and what skills you really can't train for. When you're looking for someone for your front desk, or your medical assistant, or your dental assistant, or your provider, obviously the providers need to have education. They need to have the knowledge, the abilities. But your front desk staff, you might be able to train them in certain areas there, but what you really need is you need someone who's good customer service skills and the personality to actually deliver those skills. And so sometimes the personality and those traits can overrule the skills that they need to have come in, because you can train those skills. You can train someone for data entry. You can't, it's hard. I wouldn't say you can't. It's very hard to train someone to have those hospitality skills that are necessary when someone walks in the door, and how you greet patients, how you treat patients. That's a harder thing to train. So that's kind of an inherent skill that people either have or they don't, whereas you can train them to do data entry. So think about what it really requires for each position. Advertising. I can't tell you, advertising is so important. You need to make the ads consistent in the sense of make sure you put the information in the ad that people need. And make them consistent in the sense that all of what we'll talk about today is part of your branding strategy. It is marketing. That's exactly what your advertising in your recruitment and retention is. It's about marketing to your current employees or future employees and presenting them one big package. So direct people to your website. Make sure your website is up to date when you advertise. Don't have an annual report there that's 2 or 3 years old. It doesn't look like you've ever updated it. And maybe you haven't, but you don't need to tell them that. Or you need to put your updated annual report on your website. And if you have people that are listed in leadership positions on your website, make sure those people are still there. And it sounds kind of small, but it means a lot when people look at your website. And people will instantly go to your website. They go to your website and Glassdoor, which we'll talk about in a minute. First 2 things people do when they're interested in looking somewhere. So you need to make sure you have that up to date. Make sure that if you are having someone do recruitment, especially for providers, that they are available to speak to those providers in the evening, during their lunch hour, on the weekend. That's when the provider has time to make connections. They don't have time during the day. They're seeing 21 to 25 patients, and they don't really have time to make those connections during that time. So make sure that whoever's doing your recruitment for provider recruitment understands that their role is beyond 8 to 5. And if you have a department that's closed during lunch, make sure someone's there to man the phones. And especially if it's your HR department, because that's really the time when even employees have time to call and ask questions about benefits, things like that. But it's also the time that people that are looking for jobs are out of the office and can make those phone calls. They can't typically make those phone calls from their desk. So it's an important piece that you need to remember to expand those hours for whoever is doing recruiting. Now, where to advertise? That's the challenge. You have the National Health Service Corps. make sure that people really know about the National Health Service Corps and that you have someone in your site that's pretty much an expert at it and can answer questions for any provider that you're recruiting. The National Association of Community Health Center website. It's a great place, especially for leadership type positions. It's a great place for that. I wouldn't say it's necessarily used for medical assistants or staff positions, but it's great for providers or leadership positions. If you aren't attending AAFP events or other job fairs in your community, you may want to start doing them. It's very helpful to start building the relationship. Even if you don't have an opening for a position, you need to start building relationships with people. I know for a long time, I went to the dental hygienist conference every year, and once in a while I had an opening, sometimes I didn't. But ultimately, there was 9 dental hygienists over the course of a few years. We had a huge dental program that were all hired, and I knew who they were when they applied because we had met at different job fairs. And they would say, Ann, I talked to you 2 years ago. And it's very important. You need to have someone give them a little time to go out and start building those relationships. With those events, also your residency programs, your HOSA programs, if you have one in your state for medical assistants, any kind of high school programs that are promoting careers in the medical field. Be sure you're speaking at the schools about what kind of careers they can have in your DECA programs, all of those different things, getting the word out about what you do. Professional journals. I would say the only place newspapers are really helpful is in your very rural areas. That's where people still pick up the newspaper, the local newspaper, and read it. Otherwise, everyone pretty much goes online. But it's also helpful in those areas that maybe is kind of a resort area. For us, we had a clinic in Essex Park. And Essex Park was the only place that we really placed an ad in the paper. Because it was a place where people would be on a vacation and they could say, hey, look at that. I can live here and work here. So if they picked that up, local newspaper at, the local grocery store or something when they were there. The other times that newspapers have been helpful is if you're in a very remote rural area. Again, people still do read their local newspapers. If you're in a remote area, for instance, for us, it was real remote Colorado, rural Colorado. And I thought, if someone wants to go to that place, where do they currently live? They have to be comfortable. I'm not going to spend money in Denver. I'm not going to spend money in big cities because that's not who we're trying to recruit. We're trying to recruit someone who's from a small town area. We placed advertisements in western Nebraska and in Wyoming. And in fact, that's where all of our applicants came from. They were already in small communities, or they were people that were in private practice and wanted to get out of that. And they didn't want to move very far because they had roots there, but they wanted to work in that rural setting. So think outside the box and think about why you live where you live. There's a reason that you're in that remote area. What is it that you love? And then really expand and promote that. And retired military, that's a fabulous place. They are committed to helping patients. And they're very quality driven, and they're very used to structure. So you need to make sure that if you are looking at retired military, that you have the structures in place to be able to support them. And you will find some wonderful people looking for jobs from retired military websites. Where you're going to advertise. Now again, you're putting together a branding. And so you want to make sure your advertisements have the same logo on them. They have the same font on them. You're starting to build your brand. So you want to advertise at medical and dental schools directly. Don't rely on just the PCA to do that for you. You can also do that yourself. Social media. Whether you like social media or dislike social media, it is the way the things are happening now. So make sure, we'll go through a little bit those in a little more detail. Direct mail to candidates. Now, direct mail to candidates now means email. I was talking to one physician, and he said he gets about 5 a day emailed to him through different recruiters, and they have pictures of the site. They have great information about the town. They have all this information about how wonderful this new organization would be that you want to come work for. Well, there's nothing preventing you from getting together some information and doing an email blast to providers. The first people that I do it to is your own providers that you currently have, and ask them to send it out to their friends. Because when we get all done with this, you'll find out your employees are actually your best recruiters that you could ever have. Staffing companies, recruitment firms, they do a wonderful job if you provide information to them. If you just sign the contract and say, please find me 2 positions, they don't have any information to work with. So again, making sure that they have all the information they need. Or speak to the STAR² Center for Technical and Training Assistance, which is free. Now, where to advertise? Now, this is a new one for a lot of people, is fishing magazines, hunting magazines, biking magazines, any kind of outdoor activity magazine. When you look at different places, and especially in Louisiana, you have great fishing, you have great hunting, you have great outdoor activities that happen there, backpacking, etc. Well, what do you think those providers or anyone else that you're looking for is reading on the weekend? And I had this idea brought to me, and it actually worked for a CEO in Texas. And her name is Rachel Gonzalez Hansen, and some of you may or may not have heard of her or know her. She's very active in the community health center movement, and that's what she does. She decided that was where she was going to go after her providers, and it worked. And so really think about what it is that attracts people to that area that you're in, and exploit that through the magazine and advertise this down your provider opening. So again, be open to looking outside kind of that standard medical and dental journal. Those can be good also. But also look at your state dental association or your state medical association. They have job boards on their site, and you can place ads also on those. So again, look around why people live there, and again, internally advertise. Because who knows more physicians in the community or in their network than anyone else in your organization? It's another physician. So active versus passive recruiting. This is a huge part. People think that, you have to actively recruit. And in reality, people are usually not seeking out a new position. They're pretty happy where they're at, but it's that they've gotten information via maybe that email blast that you sent, or that Facebook post that we'll talk about a little bit later, or your LinkedIn profile, that it just kind of happened to come across their desk and they went, that sounds interesting. Maybe I'll check that out. And that's called passive recruiting. Putting the idea in their own head that maybe they need to be looking for another job. And that's how 75% of the workforce changes jobs, and it's higher than that for physicians. So again, brand all communication. Make things very consistent. LinkedIn. 380 million members are on LinkedIn. Utilize your LinkedIn. Too many of us have a profile set on LinkedIn, and we don't actually do anything with it. Well, that's part of your recruitment strategy, and you can target just specifically physicians or just specific medical assistants, etc., with your communication. So you want to definitely be using LinkedIn to your advantage. Facebook, gotta love it, gotta hate it. Either way, doesn't matter, you have to use it. All your health centers should have Facebook pages, and I hope the PCA also has one, and so you're constantly promoting what you're doing. And invite your employees to like your page so that they can get that same information. Because too often, we kind of send all the information out to the outside world, and we kind of forget that, oh, wow, we have employees here that maybe haven't heard the latest press release. Maybe they don't have the latest information on their organization. So we've been so interested in making sure everybody else in the community has it, we forget about our internal. So it's a great way to showcase your health center and celebrate different things that happen and make people feel proud of working there. Your sample Facebook ad. This is actually a gentleman that I had gone to school with, and he does this all the time when he meets somebody. He talks about the high-quality medical assistance they need, what a rewarding job they could have, and they've also received top workplaces for Denver for 4 years in a row, and he promotes that to the nth degree. And this is exactly how he gets most of his staff. So it can be done, and those type of ads can be free. And you can actually target medical assistants, physicians, etc. You get to set those demographics of where you want that spent. So it's pretty interesting. Additionally, when I was in Louisiana a few months back, one of your own cohorts told me about how he recruited a dental hygienist through Facebook. So it does work. Twitter, if you have a Twitter account, make sure you're using it. Otherwise, it's kind of not really worth having. But again, it's a great way to get a lot of information out to staff and to potential employees. Google Plus, if you don't have one for your site, you may want to think about getting a Google Plus. But I'll kind of rip through that a little bit. Look inside. Again, your current staff is probably your best recruiters. And let me tell you, they are the best people to discourage someone from working there also. So that's why you're going to make sure that when you do recruitment, everybody knows that you're recruiting and that they're responsible to help the staff. So fair enough to look selection of applicants. Make sure that what their duties are required. Plan the interview. Look and appear and be organized. Make sure you're using behavioral interview questions. Be consistent and be a little bit informal. Not everything has to be so formal. Make people feel comfortable. Site visit. I can't tell you, the site visit is incredibly important when you're dealing with providers. Structure your day. Make sure everyone is involved and let everyone know that you're recruiting at that time. The worst thing that can happen is you have a provider walk into the clinic and was to expect them except for the medical director. Make sure everyone welcomes them. They all know that this provider is coming and include the children or spouse or significant other. Make sure that they're included also in the day. The application process. Again, make sure that you are mobile ready on your application process. Over 85% of all applications now are done via our phone. So people are, they're going to the website, but they're clicking apply now, but it's all being done on your phone. It's no longer being done even on your website, on a major computer. So make sure you're mobile ready on all your applications. And make it seamless and easy for people to maneuver around. After the interview, it doesn't matter if you didn't like the person, if you love them, whichever the case, you have to follow up with every person. It needs to be done. It needs to be done within 2 to 3 days. And because whoever you deny the job to, it's kind of like having a bad experience at a restaurant. If they've had a bad experience at a restaurant, what do? You tell 10 friends. If you had a good experience at a restaurant, you probably don't tell anybody. But if someone asks you about your experience there or says, hey, have you ever been to such and such? They have a glowing response. Same thing happens. Because even if you don't give someone a job, but you got back to them, they'll feel better about you. They'll say, yes, I interviewed there. Unfortunately, I didn't get the job, but it was a great organization. That's the message you want sent. Not, wow, they never even got a hold of me. What a bad organization that is. That's not the message you want. So you need to follow up with everybody 2 to 3 days. And it can be via text. I don't like that, but some people prefer that. But I would really try to follow up with them via a phone. The selection process is determinate. How are you going to rate the applicants? That should all be decided before you actually start the interview. Keep a spreadsheet. Make sure everyone is involved in this. That needs to be. And again, remember, personality versus technical skills. Some positions that's more important than others. and your opportunities. Do you have an in-house referral program for your employees? Because you can spend money on Craigslist recruiting, or you can spend money at your local newspaper, or if you want to promote your Facebook ad, or if you want to put it in the AAFP journal, etc. But really, your own employees, what are you doing to incentivize them? Again, the physicians in your own center, the dentists in your own center, they know more physicians and dentists than you're going to target with one ad. And so if you offer them, any number you want to come up with, if you want to offer them $2,500, if you hire somebody, give them that bonus after they've stayed for 6 months. Or for your medical assistants or your front desk staff. If you do a bonus of $250 or $500, now they're not going to refer their friends that they don't think would be good, because that reflects poorly on them. They actually tend to refer people that want to work with. Everybody wants to work with someone they're not necessarily friends with, they get along with. So they're going to refer people like that, and they usually refer really good applicants because they don't want they don't want that reflection back on them in a bad way. So it's a really great way. If you haven't started a referral program, make sure you do so. And it's a continuous process. And again, put testimonials from your current staff on your website. The one thing I would not do is ever date them. And I wouldn't date them because if you don't continuously update it, it looks like old information. So don't date those testimonials. Contracts, physicians always expect a contract. It should include what their expectations are, their termination clause for both them and you. What's their scope of work? And a notification clause. What happens if they, have their license under suspension? What happens if they have something else happen? Maybe there's a malpractice suit filed against them. What happens? What do they have to notify you about? Negotiations. Make sure that anyone that's involved in that negotiation process knows their scope of the negotiation. How far can they go with that negotiation? What is their movement, I guess? It's really hard when you're talking with the physician and say they call HR and they don't think there's any movement. You can't change the benefit structure. And they talk to the medical director and they're like, oh yeah, we can. Or if you talk to someone and say, well, the moving allowance is, $5,000. And they're like, well, I really need 8. You need to know right then and there if you can say, okay, I can do 8. Not say, well, I need to check with somebody else. So again, know your parameters. Everyone should have the same parameters so that it doesn't always require going to the CEO or going to the medical director to be able to answer their basic questions that they have. Certainly, sometimes it does require that you bump that up to those discussions, but whoever's recruiting should have a really good grasp on what parameters they can really work within and make sure that someone's not always overriding those parameters. If that's happening, expand the parameters for that recruiter because it just looks poor. The National Health Service Corps, again, up to $120,000 in loan repayment. You can do part-time providers. It's a huge recruitment tool. Please make sure you're accessing the National Health Service Corps and get someone who's on your staff who's pretty good at National Health Service Corps. J-1 visas, again, it can be a great recruitment tool. And again, it's up to you then with the National Health Service Corps or the J-1 visa to then instill your culture and mission into those people so that they want to stay longer. Now, your compensation and pay incentives, those can be a whole variety of different things. I would definitely look at this provider incentive program through NAC. There's a link there to that toolkit. Now, performance management. All of us know nobody wants to work with someone who doesn't pull their weight, right? So make sure you have a strong performance management in place program. 360-degree evaluations, they sound great that you're going to survey patients and you're going to survey vendors, etc. They're very difficult to instill. They can be done, But a true 360 is really you are surveying everybody around that person, and it takes a lot of work. Whichever way you go, make sure you're doing performance reviews of some type and that people are having honest conversations. Not everyone is at the best all the time, so make sure you're addressing those things in a realistically timely manner when it comes to performance issues. Now, retention strategies. This is a biggie. The definition of retention is the ability to keep something. So again, keeping that gold. And in order to keep that gold and go for it year after year after year, like Michael Phelps has done, he's had to work really hard. You just don't get it once and then say, okay, it's done. Your retention is a constant, ongoing thing that you have to constantly be working on. Everyone has current responsibilities. Unfortunately, in a lot of job descriptions, it includes all of these things that are on the screen right now. It doesn't include retention of employees. And really it should. So you can't have the thought that you can replace people. I mean, you can. Everybody is replaceable. But you don't want to do that. If you've hired a great person, you want to keep them. Now, if you've hired someone who isn't so great, then you need to have them go. Because that'll impact staff more than anything. But if you've got great people on your staff, you need to keep them. And it doesn't always come down to money. Money is one part of it. And when you think about the cost of someone leaving, it can be huge because it doesn't just include their salary. It includes recruitment costs. What's the ramp-up cost for a provider, or a medical assistant, or a dental assistant, or a dentist, or even an accountant? You know, when you hire an accountant into an FQHC world, that's a whole different world. And they have a large learning curve on what an FQHC is, Medicaid billing, etc. And so any of those positions that you're recruiting for, they cost a lot of money to replace. Your credentialing costs, your licensing fees for your EHR, etc. So you want to hire the best and then keep them. People leave. The number one reason people leave is their supervisors. And think about that. So really hone in on your supervisors and make sure they're providing good management, performance management. They're addressing the problems that they have, and they're also encouraging and motivating people to do their best every day. And they also leave if they feel they are not heard. And so we'll talk a little bit about stay interviews and the importance of that. They feel they aren't really cared about, or there's disorganization in that mission, or they feel as though the mission is gone. And especially when we drive productivity all the time, which is very important. But again, it's how you message that, how you brand that. You need to say things like, yes, we need this much productivity out of our providers because we need to provide this much service because we receive this much money, and then they will keep us continuing our mission. If you're only driving productivity and not linking it back to why it's important to your mission, then you're missing something. So make sure you're doing that in the future communication. Your analytics, very important to keep track of your analytics. Look at what sites you may be losing people at or what department. And then you can start honing in on what is the problem with this one particular area. And analytics doesn't have to be difficult. Start keeping a spreadsheet. Start keeping track of your exit interviews. Things like that can be very simple, that can really start to show you where you may have a problem. And it may be a problem with a supervisor. It might be a problem with someone else that's working at the site. It might be a problem with your IT system at the site. Everybody's frustrated. Things aren't working right. It could be a variety of things. But once you start tracking it, you'll have the data to actually fix it. Train the managers. I cannot say enough. You need to train your managers. They need to be able to establish trust with people, provide a culture where expectations are high, and that there's an expectation that you're going to retain people. You need to make sure that your managers know it's their job. They've hired this person. Now it's their job to retain them. And again, if you start putting that on your managers, they will start hiring the best people they can because they know it's important to the organization to retain them. provide training on people resolving conflicts, setting expectations, performance reviews, motivating people, etc. Invest in the staff. I can't tell you. People feel like when they've been invested in, they'll give back a lot more. So it may be formal training. It may be doing a webinar like this. It may be just sharing, a latest management book at a lunch and learn over lunch, a brown bag lunch. Let's talk about a book that we recently read on management or on good hospitality. So recognize people. I can't say enough. You need to recognize people, whether it's informally, formally. Ask people if they want to be recognized publicly or if they prefer it privately. Either way, it doesn't take much to recognize people. Please make sure you're doing that. Again, hire only the best. So structure your interview. Do pre-screening interviews if you need to. Add both situational and behavioral-based questions into your interview. You have to have some closed-end questions. Make sure you're including those behavioral-based interview questions also. Define what you need before you start. Too often we start, and then we have a great person that interviews, and we're like, that's what we need. Decide what your needs are before you start your process so that you can make sure you're hiring the best fit. Ask people what tools they need to do their job. This is a huge retention issue. Again, people need to be heard. So during staff meetings, ask people, what do they need? Do they have everything they need to make their job the easiest it can get? Sometimes it's very simple fixes that people come up with, and it makes a world of difference in their day. And then do they have the training on what they're expected to do? Make the job better. It doesn't always have to be a ton of flexibility, but look at how much control do they have over their day, how much control do they have over their culture. Ask people, survey and listen to people, and never ask a question that you're not willing to give me. But always make sure you're doing stay interviews. So your stay interviews, you could start with your provider and go and spend 20 minutes to a half hour with them and ask them what it's going to take to have them stay. What do they enjoy about their job? What tools do they need to continue to have their job? There's a whole variety of stay questions, and I can send some to Danielle that she can maybe share with you afterwards. But those are an important piece. One, they make the provider or any employee feel like you care. Two, you need to have somebody do it that has a very open mind and that's willing to hear what their answers are and not just defend what the organization does. And three, you need to actually follow up, though, on things that you've promised to do. And if you do those three things, you will make a huge difference when it comes to your engagement with your employees and their willingness to want to work through when you have tough times. They'll be the people that are really fighting for the organization to continue to strive for quality and continue to have productivity, et cetera, et cetera. If they feel like you've helped them out, they'll help you out. Mission. Always make sure you're staying true to your mission. So when it comes to access values, any financial decisions, expansion, and staffing, and it's always important when you're dealing with performance-related issues especially, is that we remind the employees that we're here for the patient. And so if someone's coming in late and that's impacting patient care, that's what we need to focus on. Not the fact that they came in 3 minutes late or 8 minutes late, but hinge that back to why it's important they were here at 8 o'clock and what happened because they got here late. We weren't able to check this patient in a timely manner, and therefore it threw the rest of the morning off. Or this person that patient now has to be late for work because you were late coming in. So always point it back to how it affected patient care, not so much on the smaller detail of they were 3 minutes, 4 minutes, 5 minutes late, but again, tie it back to your mission, tie it back to patient care, and always continue to let people know what you're doing. So communicate the benefits, your total benefit statements, your press releases, everything. Your employees should know everything that you're sending out to anybody else. They need to also be included. Your patient statistics. Let them know how many patients you saw. Too often we put it on the UDS, and it goes into the government, and they all get to see it. But unfortunately, we don't share it with our employees to say, look at all the work we've done last year. Look what we've done. And be sure to share that information with them. Now, this is Allison's contact information. Be sure to contact her if you need any kind of technical assistance with recruitment and retention. It's totally free. There's my contact information. Then there's some other resources here. Again, visit the STAR² Center, phcworkforce.org, and look for all that information that's on that website. It's fabulous. And then there's also the NAC Recruitment and Retention Toolkit, and that's being updated currently right now, and it's going to be a fabulous thing when the new one comes out. But let me tell you, the old one that's there is also fabulous. So be sure you're looking at both of those information. Remember the Regional Primary Care Association, your public health institute that's providing this today, NAC, the National Health Service Corps, 3RNet. All of those are great resources. Don't forget social media. Your local chambers of commerce, I can't tell you, contact them. Contact your hospitals. Get information that you can provide when you're recruiting about your community. Do you have current data from the local chamber? What's available in your community? Make relationships with the schools. If you have a provider coming in town for a site visit, make sure they're set up to visit with some of the realtors and they're able to visit with the school district. But more importantly, in addition to that, make sure that you brief your school district representative on all the good work that you do in the community and that you brief that realtor and kind of set that message that you want sent when that provider then goes off with that realtor by themselves and they spend the entire day together. You want that realtor to be on your side and talk about what a wonderful organization you are and have actual information to talk about. Your stay interviews, they're huge. I will send some information to Danielle next week, and she can send it out to all of you. If you're not doing satisfaction surveys, please do that. Again, though, only ask questions that you're willing to actually make changes on. And communication is the key. Your current employees are the best recruiters and retainers that you have, so don't forget that. You can pay anyone else to help recruit, but really they are your best people. So with that, I want to thank you and find out if there's any questions.
All right, thank you so much, Ann. So again, just to remind our participants, if you do have a question, please type it into the question box on your GoToMeeting dashboard, and we will give folks a couple seconds to type in a question. We only have a few minutes left, so I think we can only do about 1 or 2 questions. Okay, and so one question is, can you give an example of a clinic who experienced a turnaround in their retention and what strategies they used to do that?
Yes. There's a few clinics that I know of. Stay interviews were very important. And that's why I really stressed those, because they really surveyed the current people that were there, or they even called people that had left. And that would be more of an excellent exit strategy. But finding out really what needs to be fixed. And again, you need to have someone do that with a very open mind, because too often people get very kind of defensive, like, oh no, that really isn't kind of how things work, or they find kind of excuses for what people tell them. And you can't, you need to be very open. And they have turned their recruitment and their retention around completely by doing those 2 things. And you need to have someone do it that's very trustworthy and that will not be defensive. And if it can be, if you're a smaller health center, if it can be your CEO or your medical director, that makes a huge difference, because those providers really feel like, wow, they care. And they need to tell people what it is they need improvement. And so don't let people just skate around that. What exactly is it that you need at this site?
No, go down.
Does that answer the question?
Yes, thank you. All right, hold on. We're just looking to see the other ones that are coming in the box. Click on the question. Click there. Okay, another question is, we have a really good staff, but there's a lot of gossip and assumptions. How do we stop this from happening?
That's a key one. You know what, and my favorite thing, and I'll just put on my HR hat here for a minute, is that gossip continues because people listen. It won't continue if there's just no listening to it. And probably the best thing I ever did when I had to deal with that is that you'd usually have one or two complainers. And so I really basically pulled the staff together after talking to different people individually and say, you know what, you all are responsible for the work environment that you work in. Because the organization only has so much say in your work environment on a day-to-day basis. But you all set that tone. And you all have control over how you want to get along each day and how you want to interact. And so really putting it back on them if they're complaining about gossip and things like that. And, you know, to some extent, if they're spending a lot of time doing that, you might want to remind them that maybe they don't have enough work to do. Sounds bad. But, you know, reality is, if they have a lot of time to do all that stuff, then maybe they need a little bit more to do. And at the same time, pay attention to the grapevine. Gossip can be really good to know as a leader in your organization as to what needs to change. Yeah, and gossip will always continue, but if it's harmful to other people or it impacts in their job, that's when you need to get involved.
All right, thank you. Since we are just a little bit over time, we are going to go ahead and wrap up. Thank you so much, Ann, for sharing your insight with us today and for sharing those resources from the STAR² Center. This concludes our webinar. If you missed part of the presentation or would like to share it with a coworker, we will be posting it on our Wikispace site. And when I send the link to that recording, I will also send Ann's contact information and the information for the STAR² Center. So thank you so much and have a great day.
All right. Thank you, Danielle.
All right.